So what is primary care, you know, what does that mean? It's used so generically now. Primary care has changed so much over the years from when I started practice about 25 years ago in a small town where I grew up in a rural area, delivering babies, taking care of patients in the hospital, going to the ICU, being on call all the time. It's different now, but the idea of primary care is we take care of you from cradle to grave. It's the doctor who takes care of your kids, you know, your parents, and you. That part of it still exists. Primary care mostly are family physicians, like myself, sometimes internal medicine physicians. But the idea is that we're offering the first line of comprehensive care. We're the first person to make that diagnosis or treat you for blood pressure, treat you for diabetes, get you started, make a referral if necessary. Kind of the gatekeeper of medicine. It's a specialty which there's a tremendous shortage of. We don't have enough. It's a specialty which has not been reimbursed in the same way other specialties have in this country. Thus, it's disproportionate. We're 70% specialists in this country and 30% primary care doctors. So we got it all wrong. So primary care is the first person you see to provide you initial care and hopefully provide you with a continuum of care throughout your lifetime. Make the diagnosis and then treat you. And I like to say with primary care, I rarely completely cure a patient. I mean, if it's something simple and a minor surgery, but it's a continuum of care for me to extend your life, to make you live healthier longer. That's what a good primary care doctor does. And that, unfortunately, is kind of what we're lacking. No fault of, you know, anybody's in particular, other than the world has changed. Doctors aren't in private practice anymore. They work for systems in the hospital. They may work for 3 or 4 years, get another offer, and they leave. And then we've got this crazy thought that the hospital system sometimes thinks that they're your doctor. Who's your doctor? I don't know, this hospital system. I won't mention any names. But no. I'm your doctor. They're not your doctor. You can't just replace me with someone else. But that's unfortunately what's happening because the economics have caused this. The fact that there's such a shortage of people like family doctors like me that basically anywhere in the country you could go. And also the fact that it's now changed. Instead of me delivering your baby, I probably wouldn't do that anymore. You might go to the hospital, have your baby, and you'd be delivered by a laborist. Well, what's a laborist? Well, he's a doc who works 24-hour, or she, 24-hour shifts, and then she's off. It's all changed. Well, what if you go to the hospital? Well, then you get a hospitalist. Well, what's that? That's a doctor that just works in the hospital, and she works in the hospital 7 days in a row, and then she's off. And they even have surgeons now. All they do is work in the hospital, but you don't have a release. So that whole thing. So the only doctor that's left, last person standing, is the family doctor to provide continuity of care. Do you see? The entire system's broken. It's all siloed. There's only one person that knows you. Anyone ever been to the hospital and no one knows you? And all of a sudden, yeah. You'd like to think they call us. They don't. In fact, I call them and recommend, I'm sending a patient in. I want her to be admitted. Do they call me back? No. It's a broken system. But you know what? We got a medical school here. We're going to fix it with young men like this and women. Very many of our female students here, but we're going to fix this. We're going to make a better humanistic doctor that cares about you. But let's start with what primary care does. So the evolution, the old family doc, house calls, all of that, that still happens a little bit, not to the same extent, to where we are now. Medicine certainly has changed. What has changed about medicine is we're much more technical, much more information is available. There are more medications for me to choose from. There are better treatments to make you live longer. All of that are positive things. It's now, unfortunately, much less human. much less actual interaction with your physician. She's typing in the computer or feeling she's got to get her notes done, has her hand on the door ready to leave. You have exactly 7 minutes. The average doctor interrupts you every 17 seconds, so you never quite get out what you want to say. That's another broken part. So there's been a real evolution of where primary care is. But, next slide. But what hasn't changed is that we are dying in alarming rates in this country from preventable diseases. Chemung County, wonderful place to live. I love it here, but when you look at our rates, and I'll share some of that with you, we're among the sickest counties, sickest regions in the southern tier, actually in the entire state, because we have smoking, about 10% higher than the rest of the state. We have diabetes, we have obesity, we have high blood pressure. Which one of those is not? They're all preventable lifestyle kind of things. All of them that if we had family physicians engaged, we could make a difference. And not to mention the cancer. In fact, the death rate in this county is higher than just about every other county in the state. We have the premature death here by about 2 years. Some of that is related to the fact that we don't have enough primary care. Some of that is about access to care. And some of that is just the way that things are kind of managed in this very broken, disrupted, siloed healthcare system that absolutely is just broken and shattered after COVID, and we have not recovered, So go back a moment if you don't mind. So chronic conditions, the whole idea is to prevent them. I don't want you to get breast cancer, so we recommend mammograms. Colon cancer, we do screening. Giving you vaccinations like flu shots prevents you from going to the hospital. Or COVID shots, which I know there's been a lot of concern about the boosters and such, but the reality is we are now in the green. It's not by chance, that's because enough people have had it and been vaccinated that our rates are actually down. And then, of course, managing mental health issues, which have gone largely ignored with COVID. We've got depression, anxiety, all kinds of things as a result of this, and addiction. We have none of that, I think, is particularly well managed here. Primary care plays a role with all of that. Addiction is something in particular that I have a family member who has it. I feel that pain every day. But a lot of people don't want to talk about it. That 1 in 2 families have someone with some kind of addictive disorder. But that's out there. There's another area that primary care engages and makes a difference. So the whole idea for primary care and where is to prevent things. Prevent. And that's what's missing. So in preventative care, what is it? It's getting a simple blood pressure. Tonight, if you want your blood pressure checked, these 2 young men, Joel and Jacob, will check your blood pressure. And if it's high, we're going to get you an appointment as early as tomorrow with someone to treat that. Prevention. What does treating blood pressure prevent? Well, strokes. Stroke and heart attack. Simple. Blood pressure. And the medications are available and out there. So diabetes screening, as simple as getting a blood sugar checked. A simple finger stick in the office. Cancer screening, colon cancer screening. You don't all have to have colonoscopies. We have a test now that we can actually, called, have you heard of it, Cologuard, where we can basically take a stool sample, Cologuard, and send it off and find out if you have colon cancer. There's all kinds of non-invasive things we can do. And of course the vaccines, which are so important. So the first reason to have a primary care doctor is to start with prevention. Now, you didn't tell me we'd have a musical background too, and I go, thank you. I like it though. All right, so it's these kind of things, simple things, will save your life. How many years do you think smoking takes off your life? Anybody have a guess? She said 20? Yeah, 10 to 15 years, done. counseling patients to stop smoking, giving them blood pressure the same, cholesterol, diabetes, all of that goes together to shorten your life. So, number 2, this healthcare system is broken. We've established that, right? You need an advocate. You need someone to fight for you. The insurance companies are against you. They're not for you. What are they for? What do you think? Well, who do they care for? Well, if they're for profit, they're for the shareholders. They could care less. Even our Fidelis, they're now managed care, just so you understand. So they've sold those out to managed care companies. What do? Their first answer is always what? No. No. No, she doesn't need that. Well, I think she might have a blood clot. You've got to get prior approval. Prior approval for what? I'm concerned she'll have a blood clot in her lungs. A family doc who knows you can then go to the insurance companies and fight for you. Why does that matter? Well, I'll tell you why it matters. Because I had a friend, and it wasn't his doctor, unfortunately. And he'd had cancer before, a couple of years ago. And he'd come to my house to do some work. He'd had some back pain. I said, hey, you better get that checked for your doctor. I'm worried about you. You have back pain now. You had cancer. Well, of course, he couldn't get in to see his doctor right away. Finally, when he did, they'd ordered some tests, an MRI, but the insurance company said, no, you don't need that. You just need a plain film x-ray. So he did that, followed their orders, fighting with the insurance to get it approved. Unfortunately, that never happened. By the time it did, he was in the ER paralyzed with metastatic cancer till his lungs, till his back. He's dead now. That was in December. Didn't have an advocate to fight for him. Didn't have a doctor that would have called the insurance company. This is my patient. I know him. He had cancer 2 years ago. This is cancer until proven otherwise. I hate to be so graphic with that, but that's the reality. You need an advocate to go to bat for you. What do they do in the hospitals now? They have what's called a prior approval department. Okay? So that means they try to take it out of my hands that you know, that the prior approval is going to fight for you. They don't even know you. So, relationship with a healthcare advocate, someone who is going to advocate for you. You end up in the hospital, they advocate for you. You end up being referred to a specialist, they know you. So multiple tests aren't ordered again. They make the appropriate referrals. They understand the medications. How crazy is it getting now? I've had patients see specialists, cardiologists, and they have high blood pressure. Now, it's a cardiologist. These guys are pretty smart. You know, they see my patient has high blood pressure on the visit. Do you think that they adjust the medications? No, go back and see your primary care. Hey, you're a cardiologist trying to prevent them from... That's what's happened with medicine, with specialists. They're not going to manage any of these conditions. You see an ENT, they're going to look at your ear and your throat problems. You see a cardiologist, they're going to say, this is the organ I look at. You see a GI, they're going to do their colonoscopy and say, go back and see your primary care. What about this? Go back and ask her. That's what's happened. You need someone in the system who will advocate for you. And that's primary care. Nobody else will do that. The complexity of the healthcare system I've mentioned. Had a friend, again another. I have a lot of friends who call on me when things don't work out, not their doctor. If I'm your doctor, I'm doing all this for you, but ended up in the hospital with severe back pain, couldn't move her leg. You know, they did all the tests, did an MRI, did all this, and said, well, you don't need to see, we're going to send you to your pain management doctor. You don't need to have a neurosurgeon. So we discharge her from the hospital, because the pain management doesn't come there, send him to the office to get an injection, and she still can't walk. Finally, I said, did they go over your MRI with you? We look at the MRI. She's got a huge old herniated disc. I call the neurosurgeon. Fortunately, he's my friend. And I said, will you see this young lady, please? Yeah, she's operated on Friday. She's walking again. You can't navigate this health system anymore. It's too broken. You can't navigate it. I even say to my friends, I don't know how this gets navigated. My wife can't navigate it. She goes, hey, what should I do? They're not calling me back. I don't know, honey, you really want me to blow crap up? I will, but I try not to do that because I do it too often anyway. But the point being, it's almost impossible. And we got to do better with this. And then we say, well, we referred you to the specialist. I love this one. They're going to call you. Well, then they don't call you, and then you call me. Didn't they call you? No, doc, they didn't call me. This happens every single day. Thank God we have a case, Nicole, to actually manage some of this and help us. Thank God. But we need about 1,000 more to follow up on these patients, because otherwise things just fall through the cracks. You miss that appointment, you miss your colonoscopy, you end up with colon cancer, you don't follow up. So primary care will help you navigate this system, which is becoming more and more complex. What's driving this? Economics to some extent, because we're cutting everywhere. If we spent more money on prevention, we would end up with much less patients in the hospital. If you had a primary care and you called them and said, can I see you today? And I just said, come in, and you didn't go to the ER, you'd end up not being admitted to the hospital and probably prevent a hospitalization. Everything is broken in it. So you need someone to help you navigate this system. And if you all have doctors and they're not doing that for you, get another doctor. That's their job, to help you navigate this. They fight for you. No one else fights for you. Insurance companies, health system, no one is going to be your advocate. You've got to have, obviously, you've got to be your strongest advocate. You've got to have a doctor that's going to, well, I'm not going to accept this. We're going to do this, this, and this. Not to mention what happens with medications, by the way. I write something and the insurance company doesn't cover. If it's something I really think you need, we're going to fight for that for you. But otherwise, their default is always generics. It's not always generics, actually. Sometimes the insurance company cuts a deal with the drug company, and it's not a generic. The generic's then more expensive because they cut a deal. Think I know? I have no idea, you guys, when we write those medications. It's all done underhand, and we only find out on the back end how this all works out. And that's just part of the general dysfunction of the U.S. healthcare system, which we're not going to solve today. But what we are going to do is say, if you have studies show that if you have a family doctor, you go to the hospital less. You have less ER visits, less use of the hospital, because a good family physician, she'll keep you out. They'll see you as often as you need to actually stay out of the hospital. So numerous studies have shown that by being connected to a primary care, you will not have to use the hospital. And one of the things that I'm a little upset that I sometimes see happening, and I think, again, being an advocate for you, when you're sick, your doctor should see you. At least the office should get you in and not do you can just go to WellCare. And WellCare then never sends me anything. They don't even call me that you're there. The best thing would be to say, when you're looking for a physician, will they see me? Will the office at least see me if I'm ill? Will they get me in? So at least you're in the same practice, so we know you. But unfortunately, we're all too quick to refer to walk-ins, which, by the way, let me tell you a little dirty secret about walk-ins. Guess where they put walk-in clinics most of the time? Where do they put them? They put them in areas where they think there's good insurance and they're going to get a lot. And they never put them in areas where there are people who are of low income. They don't put them there. That's what they do. And what do the health systems do, by the way, too? They try to say, we want to put a hospital or a clinic in an area where there's a good insurance, like a lot of Blue Cross or Blue Shield, because basically Medicaid and Medicare, they pay less. So that's part of the problem with some of these walk-ins. They also turn patients away. So I'm not a big advocate of like these for-profit walk-in centers, some of which we have, will go unnamed here in town. I'm not a big advocate of that because I think they're cherry-picking patients off. And then if it's anything complex, well, guess what? You got to go to the ER too. And if you go to the ER, then you got to have a double bill. You get your walk-in, and then you also get the bill from the ER. So The reality, though, if you have a competent family physician, you use the hospital less, you use the ER less. That's a fact. Studies have shown that. Why? Because the majority of things that end up in the hospital nowadays, it's not these acute things like I'm having a heart attack or this. It's actually chronic conditions that are not well controlled. It's diabetes that's out of control. It's an infection of the leg. It's a complication from high blood pressure. It's typically a chronic condition that we know about that's just not well controlled. Finally, primary care, you live on the average per year, so if we keep 50 days longer by having a primary care doctor. So add that up over 30 or 40 years, you add 2 to 3 years to your life by simply having a family doctor. All right, so for every 10,000 primary care docs out there, the patients assigned to them, they live an average of 56 days longer. You live longer by having more family physicians in an area. Our particular area, we have a proportion about 1 to 1,200, one doctor per 1,200. Optimally, we want that around 1 to 1,000, thereabouts. And the higher that percentage is, the better off the community is in their health care. Chemung is starting to catch up, but we're not quite there yet. So, reason number 5, you live longer. So, looking at Chemung County, premature death rate, there we are, we are in the red there on the top. So we're dying about 2 to 3 years earlier than other counties in the state. That's not right. That's not acceptable to us. We're also the least healthy. So least healthy as far as chronic conditions. Least healthy as far as factors to extend our life. We're the least healthy with all of that. We're failing this community in our health care. So we need to fix that. So, today, if you smoke, you're going to stop. Just stop. 10 to 15 years off your life. Get your loved ones to stop. There's free things available to help you stop. Nicotine gum, Nicorette gum, all kinds of things, the inhaler. If you don't exercise, you're going to start tomorrow. Just walk. All I want you to do is walk. 5 minutes, then extend it to 10, and then 15. Just walking 10 minutes a day will make you live longer. Truth. Watch what you eat. So, simple way to do that is, maybe cut down what you're eating by a third. A third. Just a third. Eat a little less. That's hard sometimes. I say that as we went to this wonderful French bakery yesterday. I was off, and Skinny Alice and I ate 2 loaves of bread, which was terrible, but I paid for it today, by the way. But the point is that we eat a little bit less, keep our weight, we'll live longer. Another big factor that we, as Americans in general, and here is we're stressed. We're so stressed, and a lot of that's related to our sleep. Probably the single most important thing you can do is get 7 hours sleep. Studies show you live longer. 7 hours sleep, also you lose more weight. Just sleeping, shoot for 7 hours. Who gets 7 hours a night? Just these 3 girls. Ladies, come on. That's it? They sleep, they probably. 7 hours. Minimum 7 hours. How many do you get, ma'am? You get 7 hours? Good. All right, yeah. It's important. And then finally, number 5 primary care tip, get a primary care doctor. Who has a primary care doctor here? All right, so about half the group has a primary care doctor. All right. So if you don't have a primary care doctor, there's the number. We'll circulate that. That's Eastside Primary Care. It's a wonderful office. That's where I work. And we have a number of doctors. We actually have 24 of them. And they're taking new patients. And if you can't get right in, you can go to the walk-in there, and they'll get you in. Yes, ma'am? It's 200 Madison Avenue. It's literally 3 blocks away. And if you ever have any problem,
it's the old, they used to call it eye.
That's right, yes.
Right over here, right across the street with your eye.
And if you, right across from there, and if you can't get in there, you tell this beautiful lady here, or you call me directly, you call me and I will make sure you get an appointment there. All right, we'll make sure you, but establish with a doctor. There are 27 of them there. They've got, you know, you can pick your doctor. Female, male, you pick who you want to go with, and they're wonderful. And they'll provide wonderful care for you. And they have a walk-in there as well.